Welcome back. A lot of people say this could be the near future of America, Italy, and they're continuing to be the hardest hit country globally. Of the 11,000 total deaths from the virus in that country, more than 800 people have died since just yesterday. Dozens of doctors have also made the ultimate sacrifice. The latest number, somewhere around 63. Take a listen to a couple of physicians on the front lines there.
This week has been particularly difficult because my hospital is overflowing of patients.
My wife is pregnant and I have a little child of 18 months. We decide to live separated since 15 days. So I come back at home, sorry. When I am not in the house, my wife goes in the house and leave me something for the food, for the dinner, and we see by the phone. And this is since 15 days.
Now, we want to get a first-hand account of what is going on in Italy. For that, I spoke with an MD at the University Hospital of Udine, Dr. Fabio Zattoni. He also happens to be my cousin. New York now is seeing these crisis situations in our ICUs like in Italy, doctor, and you've been dealing with this for weeks now. As these scenes go from bad to worse, try to prepare our medical staffs and our public for the scenes that we're going to encounter and the physical as well as the emotional toll that the doctors or nurses will go through.
Well, pandemics have already shaped cities. COVID-19 is doing it already, such as increased surveillance and de-densification. It will for sure change our way of living. Especially healthcare workers are already seeing worrying signs, decreasing equipment, growing number of patients, and doctors and nurses who are themselves becoming infected. I suppose that special interventions to promote mental well-being in healthcare workers exposed to COVID-19 needed to be immediately implemented, with women, nurses, and frontline workers requiring particular attention.
Now, I know medical professional wants to, but what kind of life and death decisions has this pandemic forced doctors in Italy to make, given the shortage of ventilators, beds, other critical supplies?
As you already know, the danger is real. There aren't enough beds in the ICU for all the patients with COVID infection. The problem, as you say, Richard, is who gets the chance to be cured. Only a few days ago, the Italian Society for Anesthesia, Analgesia, Resuscitation and Intensive Care published the clinical ethics recommendation for the allocation of intensive care treatments. The experts refer to the COVID situation as the last bed dilemma, which briefly means that in a context of serious shortage of healthcare resources, we must aim at guaranteeing intensive treatment to patients with greater chance of therapeutic success. Therefore, it is a matter of favoring the greatest life expectancy.
And those debates we know we're having here in the States as well. Reports are that more than 50 of your fellow doctors in Italy have already died from exposure to the virus. What is it like knowing that you and your fellow medical staff on the front lines are risking your lives and often without the proper protection?
At the beginning of March, the huge influx of patients and at a frenetic pace and the widespread shortage of personal protective equipment throughout Italy were all factors that expose frontline healthcare workers to great risk of infection. Hospital staff must take care for the patients. They have little time to think about themselves. Healthcare workers, unlike ventilator or wards, cannot be urgently manufactured or run at 100% occupancy for longer periods. It is vital that governments see work as not simply as pumps to be deployed, but as human individuals. In the global response, the safety of the healthcare workers must be ensured. Adequate provision of PPE is just the first step. Other practical measures must be considered, including canceling non-essential events to prioritize the resources, provision of food, rest, and family support, and psychological support. Uh, Presently, healthcare workers are every country's most valuable resources.
Finally, there are parts of this country that haven't yet fully experienced the true grip of this pandemic. What advice would you give those Americans who either want to prematurely end our quarantine or don't think this is going to get that bad?
As far as I know, in America, there are no signs that the growth is slowing, much less reversing. Now is the time to tighten restrictions on contacts that could transmit the virus, not to loosen them. If you let up now, you can be virtually certain that healthcare will be overwhelmed in many parts of your country. Dr. Fauci believes that if anything, your country should be more aggressive and do more. You can't have a functioning economy if you have hospitals overflowing. Let's be clear about this. It's not only about the number of ventilators. There is a great need of medical staff who knows how to use them. You need more medical supplies, etc. There will be also higher mortality rates for other health conditions such as heart attacks or strokes. While overwhelmed ERs, these people might not survive. US have fewer hospital beds per capita than Italy. If you want to take this pandemic seriously, I don't think it will be bad, but even worse. The virus spreads from one host to another for several days before triggering obvious symptoms. Thus, infected people need to be isolated.